Today is Thursday, March 7th. This is VOA's International Edition. I'm Lori Lundin in Washington. Coming up, on National Nurse Appreciation Week, the coronavirus has taken an emotional toll on professionals working on the front lines to save lives. President Trump reverses course on plans to shut down his coronavirus task force.
There'll be more in the neighborhood probably of opening our country up, because our country has to get open again and the people want it to be open.
Also ahead, Lady Gaga finally announces a release date for her new album. It's all on today's International Edition. Wednesday was National Nurses Day, marking the beginning of National Nursing Appreciation Week. It's celebrated every year to raise awareness of the role of nurses in society, and of course we know they're needed more than ever. At least 90,000 healthcare workers worldwide are believed to have been infected with COVID-19, and possibly twice that according to the International Council of Nurses, which says the disease has killed more than 260 nurses. And while they and other health professionals are used to dealing with trauma, they are now on the front lines of a crisis of the likes they've never seen. Joining us to talk about the mental health toll that the coronavirus pandemic is taking on nurses and doctors and other healthcare professionals is Leslie Oleck, psychiatric mental health nurse practitioner. Thank you for being with us. I understand hospitals and universities have been providing support for stress reduction through programs like meditation and yoga. Tell us about those programs and also, of course, the toll this is taking on healthcare professionals.
We're encouraging our nurse colleagues and our healthcare worker colleagues everywhere from physicians, nurses, social workers that are on the front line dealing with families that suddenly have no jobs, no homes, no food, to the cleaning personnel in the hospitals they too are putting themselves on the front line to make sure that it's safe for patients to go in there and safe for the other personnel to go in there. So we're encouraging them to consider the resources that are out there. Unfortunately, nurses and doctors especially have been sort of trained that, well, we can handle anything, and basically we shouldn't worry about getting upset. I'm lucky and honored to have some nurses in my caseload who are on the front line in ICUs and afraid to go all the way home to their families, or they go home but they stay in a certain part of the house. So it's very isolating for people who aren't even in a particular quarantine. We know there's a lot of secondary trauma. Theoretically, a crisis situation is supposed to last 4 to 6 weeks. Some of the early stages of working into a crisis include anxiety and worry that they'll be able to take care of things. And suddenly when they're in the crisis, it's like, my resources are exhausted. I have no way to take care of this. Most of us can say, last year I had a similar situation and this is what I did, and, it turned out okay. Mm-hmm. This is the kind of situation where last year, if you used personal protective equipment and it worked fine, this year, we don't have that personal protective equipment as readily as we, I think, should. We don't have enough numbers of healthcare workers. Nurses are the largest group of healthcare workers, certainly in the United States, and my hunch is in the world. And there aren't enough of us to take care of all the people and all the situations that are coming up. And that is totally without precedent. And so we're in a situation in which many of us and most of us have never faced before. Right. Not only uncertainty for the healthcare workers, it's uncertainty for us.
What are some of the mental health issues that come with all of those things for people?
As we look at, I'm not sure how to do this, we notice that average people as well as the healthcare workers are having symptoms such as sleeping problems, feeling anxious, kind of underlying anxiety all the time, and other times it kind of comes to the forefront. The definition of anxiety is you can't identify the fear. So when folks are not at work with the COVID, they still have the anxiety. When folks have never worked with people with this virus, they have the anxiety. So we're looking at a lot more anxiety, which is already the most common mental health disturbance, certainly in the United States. The mental health aspects of just quarantining, the social distancing is hard for people. So that isolation, we know that when people get depressed, isolation is what we say not to do. We say, don't isolate. That makes it worse. And here we're telling people who not only have existing mental health problems such as depression, but all kinds of people that don't have any identified mental health issues being told to isolate, and they're becoming withdrawn, depressed, listless. The motivation goes down.
Nurses and healthcare workers, they're dealing with a lot more death than they're used to seeing. Combine that with having to become the last person these people see, so they're almost taking on the role of a family member, dealing with someone dying alone without their family because they're not allowed in.
We're seeing secondary trauma kinds of things where the nurses feel so badly for that person, that family member who can't be with their family members. And then when they go out and tell the family members of the person that's dying or just died, then they experience that trauma as well, because of course the families are distraught. So they're caught in the middle and not being able to bring people together. Nurses are very good at bringing people together, and we can't do that now. It's a moral distress kind of thing. It's like, well, my family's standing right out there and they can't come in here and tell me goodbye. How wrenching can you imagine that is? And certainly other kinds of moral distress would be not being able to care the way you want to for a patient because of lack of personal protective gear, or not being able to go home and see your own children or hug your own children because you feel like you may carry home the virus to them. I mean, being a nurse, there are times you don't take time to go to the bathroom. I also have noticed that universities are starting programs where they're using the psychiatric providers of the university to come and do mindfulness or make themselves extremely available to work with folks that are on the front line through such things as mindfulness, deep breathing, anxiety-reducing kinds of activities. The crisis support hotlines are seeing a lot of business, and it's not just healthcare workers. There can be acute stress syndrome as well as post-traumatic stress syndrome. Mental health workers have to prepare for probably some astronomical new numbers coming our way. Hopefully we're ready for that. You know, psychiatrists, nurses like myself, nurses on the front line in the inpatient hospitals, as well as social workers, mental health counselors, masters of divinity, marriage and family therapists. We all need to prepare ourselves because we're going to have colleagues and family members and neighbors coming our way.
That was Leslie Oleck, psychiatric mental health nurse practitioner. Thank you for being with us. National Nurses Week culminates on May 12th, the birthday of Florence Nightingale, thought to be the founder of modern nursing, and especially for her pioneering work during the Crimean War in the 1800s. Here are some of the other stories we're following at VOA. The lead U.S. airport security agency is weighing the possibility of requiring masks or face coverings for passengers passing through checkpoints. The move is part of a broader rethinking of how to limit the spread of the new coronavirus during air travel, an effort that could bring some of the most significant changes to the airline industry since the September 11th, 2001 attacks. Scientists at the University College London's Genetic Institute on Wednesday said a genetic study of samples from more than 7,500 people infected with COVID-19 suggests the new coronavirus spread quickly around the world after it emerged in China sometime between October and December of last year. They found almost 200 recurrent genetic mutations of the new coronavirus, SARS-CoV-2, which the researchers said showed how it's adapting to its human hosts as it spreads. And a new facility near Pyongyang International Airport is almost certainly linked to North Korea's expanding ballistic missile program, according to a new report from the Washington-based think tank. The Center for Strategic and International Studies cites commercial satellite imagery, it says, shows the facility and a nearby underground structure have the capacity to accommodate North Korea's largest intercontinental ballistic missiles that experts believe are able to strike anywhere in the United States. Stay with VOA for all the latest U.S. and world news. The UN Human Rights Office warns overcrowding, unhygienic conditions, and lack of medical care in prisons across North and South America are causing the rapid spread of COVID-19 in many facilities. Lisa Schlein reports for VOA from Geneva.
UN officials gave no precise figures, but they say thousands of prisoners throughout the region have been infected with the coronavirus. They say fear of contagion among prison populations and lack of adequate health care for those who have fallen ill has triggered deadly riots in some detention facilities. In the latest such incident on May 1st, reports say 47 inmates lost their lives during a violent revolt in Los Llanos Penitentiary in Venezuela. Prisoners also have been killed or injured in recent protests in Peru and Colombia. UN Human Rights spokesman Rupert Colville says many prisoners have tried to escape substandard conditions in detention facilities in Argentina, Brazil and Colombia, Mexico and the United States.
The scale and gravity of the incidents mentioned above seem to indicate that in some cases states have not taken appropriate measures to prevent violence in detention facilities, and also indicate that state agents may have committed use of force violations in attempts to regain control of these facilities.
The UN agency is calling for investigations into the circumstances of the deaths and injuries during riots. It is urging states to take appropriate measures to prevent further spread of the coronavirus by ensuring sanitary conditions, widespread testing, and health care for inmates. Colville says the high number of COVID-19 infections recorded in prisons in the United States is a major concern, given the huge number of people incarcerated, some 2.3 million. He says another big concern is the large numbers of people held in immigration detention centers.
We're concerned that maybe there's not enough testing being going on in those immigration and customs enforcement centers. That said, a lot of people have been released. I don't have precise figures, but it looks like it's in the tens of thousands of people have been released across the country.
Colville says conditions in detention centers and prisons should be regularly monitored by independent bodies. He adds prisoners who become infected with COVID-19 should be put in non-punitive isolation or quarantined in facilities where they can receive appropriate medical care. Lisa Schlein for VOA News, Geneva.